Welcome to the GAO Ask Dr. Kim channel. This video clip is for dentist. Let's learn dental implant treatment with GAO.
Hello everybody, welcome to the GAO Ask Dr. Kim channel, and I'm Dr. Kim, who is one of 5 director of Global Academy of Osseo Integration and also founding member of Global Academy of Osseo Integration. Today I'm going to share the sinus bone graft and the GBR case for dental implants. Let's get in. Well, 52 years male patient, have a lot of things to do because he has many missing teeth and is mobile on number 11 in the front tooth and many things to do, but I want to focus today on this white posterior maxillary, light maxillary posterior area. From the periapical views, you can appreciate the bone defect on number 14 area, and buccal and palatal bone was missing, and also you can see the inferior border of the maxillary sinus, and there's not much bone available for the posterior maxillary implant. From the CT scan, also you can appreciate the bone defect here and the small mucosal thickening on the posterior area. Other than that, everything looks normal. From the clinical picture, you can see the defect on number 14 area as well. So when we draw the line on the inferior cortical bone of the maxillary sinus and the cortical bone, crestal bone, you can draw the margin of the bone like this. So when I open the flap, you can see the curvature from the vertical line. From top to down, you can see the turning points here. So when you continue to draw the line, you can connect these turning points like this, and this should be the inferior cortical line of the maxillary sinus. Oftentimes, if the bone is thin, like here, you can see the bluish or black shadow underneath of the bone. That's how you know where the maxillary sinus is. Then I open the maxillary sinus, like I made a window, bony window here, and the front part, front as possible, like a mesial as possible, down as possible. So I made the osteotomy like a window with the SLA kit from the Neobiotech, which I love, and I use the LS limmer. Usually there is 2 types of limmer, C limmer and LS limmer. My favorite is LS limmer, which always, most of the time, it leaves the bony disc when you open the window. Okay, I think I'll have a chance to explain about this kit later on in different clip, but today I'm gonna just move on to the next slide. For this patient, actually, I made 2 windows. Okay, I connected together. I carefully dissected with the instrument called FLIR, which also included in the SLA kit. Also, I'll have a chance to explain it later. And I carefully dissected the maxillary sinus membrane and elevated. I filled the bone, and this time, for this patient, I used the carpor, which is alloplastic material, and the FDBA, allogenic bone, mixed 1:1. It's almost equal amount together. And I put it in the underneath of the sinus membrane, which I elevated, and I filled the bone defect on number 14 area together, and I cover with the cytoplast mesh, cytoplast flex, mesh flex, which is a titanium membrane. At this moment, I was not available to use the titanium mesh from the Neobiotech, which I'm using it now, but this time there was not in the market, so I use a cytoplast mesh flex membrane. Okay, so this membrane is very thin, it's too flexible, and also very hard to remove it because it has a rough surface. Okay, anyway, I used it, and I closed it with the sutures. So this is a panoramic view immediately after the sinus bone graft and the GBR. Oftentimes, I do place implants simultaneously with the sinus graft and then placing the implant. But for this patient, I know I'm gonna place number 14 later, so that's why I decided it in different type, like a different time. So I make it separate, okay? So I'm gonna place implant later on. So from here, this is the immediately after the CT scan, and this is just before the implant placement. As you see, the grafted bone is much consolidated and in here compared to right after the implant place, the bone graft. So by the time I'm watching the bone graft here. Okay, so after a while, like a few months later, in 2012, I opened the flap for implant placement. I removed the cytoplasm mesh, flex mesh membrane, and I placed 3 IS2 implant from the Neobiotech. So from here, this one, the one I placed on the GBR site, the initial stability wasn't that enough, so I decided to submerge number 14 implant. Other than number 14 implant, I connected the healing abutment like this. By the time I placed implant here and there, so this is how it looks. So I don't want to go detail the prosthetic phase for this patient, but this is what I usually do. I order custom abutment. At the same time, I order my technician to fabricate PMMA temporary bridges. Then I also order for the framework. So when I connect the custom abutment and patient mouth, patient will leave my office with the temporary crown. But later on, I'll pick up the framework for the final restoration. So he used the temporary crown for a while. This is the panoramic x-ray, which was taken 2013 February. When patient come back for the final restoration, I simply remove the temporary crown that I put it on top of the custom abutment. Then I try in the final restoration, adjusting in patient mouth and deliver. So this is how it looks after final restoration on number 14, 15, 16 implant. So immediate after delivery of restoration, 2013 March. So a year later, 2014, you can see it's well maintaining now. And by the time patient has to replace number 25, so I did it. In 2016 February, patient came back for the follow-up. And this is a recent panoramic X-ray, panoramic radiograph, which was taken in 2018 April 4th. So this is how I started, and after implant placement and bone graft and GBR, and this is the day of delivery of restoration, and this is a recent follow-up panoramic radiograph. So sinus graft and GBR was done 2012 March, and implant placement was done 5 months later, so 2012 August 24th. And the final restoration was delivered 2013 at March. So my last follow-up was 2018 April. So it's been almost 6 years from the sinus graft, and well, a little more than 5 years after final restoration delivery. So far so good with this patient. Okay, thank you for watching this movie clip, and I'm thinking to have another movie clip soon, and it's going to be about the sinus bone graft, but it's going to be a more complicated case. Okay, thank you for watching, and I'll be back.